afternoon, members of the media, and to the people of Bermuda. Today I am joined by the Minister of Health, the Honorable Kim Wilson, and the Minister of Education, the Honorable Diallo, Rabain, as we elaborate on the statements made in the House of Assembly today regarding the updates to COVID-19 public health regulations, schools moving to Phase 2, and pertaining to our borders and tourism. We will soon hear from the Minister of Health on the updates to public health regulations, followed by the Minister of Education. However, first, I'd like to take a moment to address the issue of Tynes Bay, on which the Acting Minister of Public Works gave a statement to the House of Assembly this morning. It is unconscionable that in 2021, we are forced to return, even temporarily, to landfilling our solid waste. What I find personally upsetting is the fact that we may be forced to do this at Marsh Folly. The people who live in this area do not deserve this, and I can assure them and the public, whilst our hope is that we do not have to do this, if we do, it will be for the shortest possible time while we explore alternatives. The people of Bermuda continue to endure the results of a nightmare one-term government who happily signed away our rights to the airport and broke the bank to support the America's Cup, all while neglecting critical maintenance at Tynes Bay, citing a lack of budget. Those decisions are still costing the Treasury daily and are also now affecting our natural environment. The Public Works team continue to work day and night to deal with these issues, and I am grateful for their approach to the problems, which has been measured, thoughtful, and in some cases remarkable, as they do all they can to provide this very important service. I want to publicly thank the team at Tynes Bay for their dedication in looking to resolve the issues in which the plant is facing. They have gone above and beyond for the people of Bermuda, and I want to send a special thank you to the team that is working there because you are doing your best. I've heard firsthand the stories of your dedication, of working under incredibly difficult circumstances, and I just want to say that your efforts are appreciated, they are noted, and I want to say thank you on behalf of the Cabinet. Now we will hear from the Minister of Health on the updates to the COVID-19 public health regulations. Minister of Health.
A year ago, Bermuda had approximately 270 confirmed positive cases of COVID-19, and very few people were in hospital. That was the beginning of our second wave. Today, with our fourth wave now declining, we've had 5,730 confirmed COVID-19 cases, more than 300 hospitalizations, and regrettably 106 COVID-related deaths in our community. While the fourth wave exalted a toll on all of us, we in the Ministry of Health are convinced it would have been far worse if not for the level of vaccination in our community. Vaccines do work. Our island data proves that. Now Bermuda must learn to live with COVID-19. The pandemic is not over, and we must continue to follow public health guidelines to keep ourselves, our families, our friends, and our community safe. Our success in dealing with COVID-19 requires a community effort, and this is one of the few situations where an individual's decision to adhere to public health measures or not impacts each and every one of us. In this pandemic, individual choices can and do have island-wide consequences. In keeping with the decrease in levels of community transmission of the virus that causes COVID-19, the government is making the following changes to our public health COVID-19 emergency powers phased reopening regulations of 2021. These include the following. The size of large groups will increase from 30 to 50, and this includes weddings and funerals as well as island boats in respect of the use of safe key. In restaurants, members clubs, and bars, tables no longer need to be spaced 6 feet apart. However, for the time being, these establishments will still be restricted to seated service only. With respect to recreational boating, raft-ups are permitted once again, and students enrolled in the school testing program will be able to use a student 7-day pass issued after a negative test result to dine indoors with their parents or guardians who have safe keys, as well as attend youth sporting and recreational activities that require a safe key. Having a school student testing program in Bermuda's public and private schools has provided a great opportunity for flexibility when it comes to dining. It applies to students that are 11 years of age and under. For young children who are 4 years of age and under, they will be able to dine indoors at a restaurant as long as their parent or their guardian has a safe key. The Ministry of Health will be working with the schools to implement the student 7-day pass as early as next week. Additional public health guidance will also be amended to state that remote working is no longer strongly recommended. Offices can be open with proper public health measures in place. Also, movie theaters, galleries, museums are also allowed, provided physical distancing of 3 feet with mask being worn at all times indoors. The legislative and guidance changes will take effect from Monday, the 29th of November. Also, a new extension to the Public Health COVID-19 Emergency Extension Order 2021 was tabled earlier today to extend the recently approved extension order for a further 30 days from the 28th of January until the 22nd of February 2022, when the House resumes back in session. It is essential to continue good public health measures. Wear your mask, wash your hands, and maintain proper physical distancing of 6 feet from others in crowded indoor spaces and outdoor settings, and particularly if you do not know the vaccination status of the people you are with. Again, to repeat myself, this is not the same as choosing not to wear a helmet or choosing not to use your seatbelt, where the person you are most likely to harm is yourself. Failure to follow the public health measures has a far more significant impact as the virus spreads quickly throughout our community, affecting families, schools, businesses, and more. In addition to assessing and making changes to the emergency power regulations, the government is also reviewing the island's travel protocols. Taking into consideration vaccination levels within countries where the majority of our travelers are coming from, as well as the vaccination levels here in Bermuda, we are looking at amending our requirements to ensure we are competitive. We will be changing the pre-arrival test requirements to accept supervised or observed antigen tests, which are less expensive and easier for travelers to Bermuda to acquire. Pre-arrival PCR tests are still recommended. While the pre-arrival antigen test provides a result right away to the traveler, observation of the sample process is required to confirm the result. The Fit to Fly certificate will be provided by the health service, be it a laboratory or pharmacy that observes the traveler as they do the test. You can do this from home by purchasing a test, booking an appointment online for the observation by video, and the certificate is then emailed to you. The observer will confirm your identity, the date and time of the test, and confirm the negative results. Entry to the United States, for example, requires a PCR test or an observed antigen test. In addition to the pre-arrival tests, we are also reviewing the follow-up testing once on island. The changes are aimed at allowing vaccinated visitors to begin enjoying Bermuda quickly without an extended period of quarantine upon their arrival. And finally, we are making adjustments to enable residents who travel abroad for less than 72 hours to use their pre-departure test obtained in Bermuda as their pre-arrival test upon their return home. This will facilitate quick trips overseas. These changes will require amendments to the Quarantine COVID-19 No. 3 Order 2020 and will be finalized shortly. Visitors to Bermuda support our hotels, our restaurants, our bars, and our taxis. They participate in a variety of experiences and visit the diverse attractions that our island home has to offer. They rent mini cars and mopeds, and in general provide an invaluable boost to our local economy. In short, visitors support our jobs. As we put in place protocols and policies which will support our economic recovery, it is only natural to consider our border controls and travelers' testing regime. As Christmas approaches, I want to provide public health advice on how to manage as we live with COVID-19, and learn to live with it we must. The government has worked to strike a balance between risk mitigation and the economic impact of taking precautions. With over 70% of our total population fully vaccinated and 79% of our eligible population vaccinated, the emphasis shifts to economic recovery. One of the most important steps an individual can take to stop the spread is simply wearing a mask and wearing it properly. That remains true, and it applies whether or not you are vaccinated. Masks should be worn by workers at all workplace settings, people using public transportation or taxis, any person visiting any indoor establishment such as a grocery store, a shop, a bank, retail, office, etc., unless otherwise allowed by specific guidance such as that which applies to bars, restaurants, and gyms, and in crowded outdoor settings when other persons are present and 6 feet physical distancing cannot be maintained. As we attend Christmas parties in the coming weeks, please be aware that social mixing is identified through contact tracing investigations as the primary means by which COVID-19 transmission occurs. Social mixing can lead to a less robust adherence to public health protocols, so I strongly encourage everyone to be careful and responsible. Above all, vaccination is the key to living with COVID-19. It reduces the severity of COVID-19 if you get infected, and it reduces hospitalizations and deaths. As reported yesterday, the booster vaccine is now available to anyone over the age of 18 who has had their second COVID vaccination dose a minimal of 6 months ago. You can book an appointment at gov.bm by selecting Book a Booster Vaccine Appointment. Alternatively, individuals can call the vaccine hotline at 444-2498, selecting option 2, or you can email vaccine@gov.bm. Those who are 65 years of age and older can walk into the booster clinic at the Pier 6, Monday to Friday. In closing, I would like to say that this government is very aware of just how difficult it is to effect an economic recovery while still in the midst of a global pandemic. And at this stage, it is critically important for personal responsibility to come to the forefront. Wear your mask and wear it well-fitting. Practice good hand hygiene. Keep physical distance from others, particularly in indoor settings and crowded spaces that are outdoors. Download the WeHealth app and avoid the 3 C's: crowded places, closed spaces, and close contact settings. We have worked hard and worked together to reach this point in the pandemic. Our continued commitment to robust public health protocols is critical, and I want to thank the entire Bermuda community for their efforts. Thank you.
Thank you, Minister of Health. Now, Minister of Education.
Good day, Bermuda. Today I will update the ongoing impact of COVID-19 in our schools and the preventative measures that have been put in place for both our public and private schools to keep our children safe. The 2021-22 school year began when Bermuda's fourth and deadliest wave of community spread. Public school staff were being sent home in unsustainable numbers, even before school buildings were fully opened. The increase of COVID-positive cases caused the Ministry of Education to make the difficult decision to begin the academic year with remote learning for our students. Our private school partners, however, began the school year with in-class learning. However, several schools were hit with positive cases, resulting in large numbers of students being placed on quarantine, one school being delayed in their opening and one school closing for a week. Despite the setbacks, there have been continued collaboration with the Ministry of Health to put the appropriate safety and health guidelines for our schools in place. As the research supports, and I've shared on multiple occasions, in-school learning is best for our students. The focus has been to minimize continuous disruption of student learning, and both public and private schools have implemented several policies to achieve this. In the public schools, a pre-return testing policy requires students and staff to have a negative COVID-19 test to enter the school buildings after a school break, along with weekly saliva testing. Private schools have implemented the lateral flow testing for staff and students up to twice a week in most schools, which includes all staff members. In collaboration with the Ministry of Health, a revised approach on how close contacts and casual contacts are treated when a positive case has been identified in a school. Instead of an entire class of students having to be quarantined, the Department of Health risk assessment now allows persons deemed close contacts to remain in school if an initial negative PCR test is obtained. However, close contacts are still required to quarantine. We are pleased about the change in policy, which has allowed more students to remain in class learning. I'm confident that the safety measures have helped identify positive cases earlier and allowed schools to remain open with continuous in-person learning for our children. Earlier this week, the Ministry of Health advised that schools could move from Phase 1 to Phase 2 of the school COVID guidelines, which means that our younger students from preschool to P3 do not have to wear face masks while inside the classroom. The intent is to review this policy in 2 weeks for a possible move to Phase 3. Many in the community have advocated for a quicker move between the COVID protocol school phases as other entities in Bermuda have, quote-unquote, opened up. However, I must remind all that schools are considered medium to high-risk locations. Students are in classrooms approximately 3 feet apart from 8:30 a.m. to 3:30 p.m. daily. Some in the public also state that COVID does not impact children as much as it does adults. During the last outbreak, approximately 1/3 of all cases were children. And to my understanding, a few of the cases can be traced back to children in child care settings infecting other children who then returned home to infect households. While children may not be affected by COVID as adults are, children tend to be around our elders who are more susceptible to COVID complications. With Bermuda's prevalence of multi-generational households, this can be a real issue. The guidelines in schools have allowed us to have schools open, keep them open, and at the same time protect our community. A relaxation in the school protocols too quickly can lead to outbreaks and cause entire classes or year levels to be quarantined. This could negate our recovery and our movement towards the new normal of living with COVID. As the community has experienced on numerous occasions, when children are sent home or schools are on remote learning, this typically results in whole households being quarantined and impacted. This affects parents' abilities to work, other siblings' ability to attend school, and so forth. When we stop to think about this, it is easy to see the potential knock-on effects of a positive case in a school. We want to, and we will, ease the restrictions, but this has to be done while keeping in mind the need to balance the safety of our children and the desire for them to remain in school. We will continue to do what is best for our students and families to keep them in school and learning. While this may appear inconvenient to adults at times, our focus must and will remain on keeping schools safe for in-person learning. I want to take this time to thank the staff of the Ministry of Education, the Department of Education, the Ministry of Health, the Department of Health School Surveillance Team, our private school partners, and the school testing team at Bermuda Molecular Diagnostic Laboratory. It is generally the collaborative effort of all involved, their hard work and dedication to ensure that our schools have COVID guidelines that have enabled us to keep our schools open and protected as much as possible. Thank you, Bermuda.
Thank you, Minister of Health and Minister of Education, and certainly thanks also to your teams for the incredible work of which they're doing. Certainly, the last outbreak was incredibly taxing on the teams at the Ministry of Health and also the hospital, and certainly the teams over at Education have done an excellent job of getting our students back in school and making sure that we adjust the right precautions to keep our students in school. The updates provided today are significant signs that Bermuda is continuing to move beyond the pandemic. We were able to do this due to decreasing transmission as well as our continually improving vaccination rates. These positive statistics are due to Bermudians playing their part in helping to slow the spread of the coronavirus and taking the personal steps to ensure that they and those around them are protected by getting vaccinated. As we make progress locally, we must also ensure that the requirements at our borders allow us to remain competitive and support our economic recovery, our tourism and hospitality industry, and the Bermudians who work within it. As announced by the Minister of Health, we will be changing the pretest requirement to accept certified antigen tests, which are less expensive and easier for travelers to Bermuda to acquire. The Minister was very clear that these are observed and certified, not someone can do it at home by themselves. We need to make sure that the people who are actually being tested or traveling are the ones that are actually being tested. While visitors will still require an arrival PCR test done at the airport, we are working to safely eliminate the requirement to quarantine while awaiting those results. These changes will allow for visitors to enjoy Bermuda and its local amenities quickly without an extended period of quarantine upon arrival, something that does not apply in many competing jurisdictions. For visitors staying 7 days or less, the only additional testing required on island to be done will be the testing needed to return to their destination. Further, we are working to ensure that any antigen test done after arrival will be administered at the hotel or guest house that the visitor is staying in to remove the requirement to travel to a location to be tested. While these adjustments are designed to make the visitor experience simpler and support our economic recovery, they do not negate the need for all persons, including visitors, to continue to observe the basic public health guidelines of good hand hygiene, physical distancing, and mask wearing when indoors or where physical distancing is not possible. The changes we are able to make at our borders are again due to our own success with vaccinations here in Bermuda, as well as the high vaccination rates of countries from which the majority of our visitors come. They are also necessary to ensure that we remain competitive in the tourism market. As we look to the upcoming new year and the new tourism season, it is critical that we adapt our approach in support of local business and the jobs they provide for Bermudians. And it is vital that we do this now so that our tourism partners know in advance and can plan for next season. Choosing not to adapt our approach could see tourists picking other destinations that are less restrictive to enjoy their vacation, and airlines make the decision to fly elsewhere as they cannot fill their planes to come to Bermuda. This would further impact already struggling businesses and jobs. We cannot allow this to happen. We must balance protecting public health with an approach that aids our economic recovery, encourages visitors to choose Bermuda as their destination, and supports local businesses. The government firmly believes that the direction where we are moving, outlined today, will do just that. And it is very important with the news of a new variant that has now been identified that Bermuda must continue to strike the right balance at the border. It is important to note that there are some persons who want no restrictions at all. But having lived through multiple waves, it's vital that we do what we can to protect ourselves at the border to ensure and minimize the possibility of the importation of additional variants. As I close, I thank the people of Bermuda for their collective work that we have done as a country to get where we are today. I appreciate that it has not been easy, but we will continue to overcome the challenges we face by working together and by each of us taking the personal responsibility to continue to adhere to public health guidelines that will help to slow the spread of the coronavirus. And that is a critical point in assisting with the economic recovery of Bermuda. I now look forward to questions from members of the media on behalf of the people of this country.
All right, members of the media, as agreed, we'll stick to 4 questions.
Premier, Minister, hello. Sean Connolly here from the Royal Gazette. If I could ask you, Mr. Premier, given that the British government is signalling that there could be an imposition of tougher restrictions in England towards Christmas, the crackdown on the continent, the new variant emerging, as you said, in southern Africa, you've now chosen this moment to ease restrictions here. How worried are you that you might be heading in the wrong direction?
I'm not necessarily worried about us heading in the wrong direction. I think what's key and critical to note is that we have to continue to evolve and to strike the correct balance. I mean, if you're talking about the United Kingdom, looking at tougher restrictions, I just returned from the United Kingdom where they have none. And that's not the case where we are in Bermuda. We believe that we are striking the right balance, but it's vital from a tourism perspective that we go ahead and adjust. We are in a different place than we were in 2020, and 2022 will be a different place where we are in 2021. And so in 2022, as we're heading into a new tourism season, the view from the government of Bermuda is to minimize the impact that outbreaks can have on the overwhelming of our healthcare system. We know that we'll have additional therapeutics next year that should be provided, the antivirals, which can also assist in reducing pressure at our hospital in the case of an outbreak. But the truth is, and this is something that is very important, visitors to Bermuda who are required to be vaccinated are not the challenge when it comes to our issues here locally. It is transmission, which happens largely amongst unvaccinated residents. Many countries have adopted this approach. Many countries have recognized that that is a particular challenge. And if we want to make sure that we can compete in tourism, to make sure that we support our economic recovery, we will have a balance. Our border policies will not be as lax as other countries because we believe in taking an approach which is appropriate. But there is space for relaxation, and we must make sure that we are competitive in that market, and that is what we aim to do.
Okay, we're obviously heading up to Christmas. We've got lots of students coming back from England and America. Will there be special messaging towards that group about how to take precautions, and will there be like a Christmas message about gatherings in households?
Minister of Health?
Thank you, Sean, for that. We continue with our messaging via social media, Facebook, and the avenues that obviously they're probably more attuned to as opposed to the mainstream media that you and I probably watch. But in any event, part of our education with respect to this is to continue the messaging and trying to strike the balance as to attracting the messaging to the right audience. And again, we'll utilize social media and so forth because we do know that there are a number of students that are coming home. And we recognize also that, closed indoor settings do create a higher risk. And as I've indicated, sometimes with socialization comes the added element of perhaps alcohol consumption, which of course limits persons' inhibitions and so forth, and you forget about the masks and so forth. So those are the types of messaging that we've started today that we will continue throughout the Christmas season to make sure that persons recognize, as I said today, that as we move into the Christmas holiday, we need to be conscious about where those closed-in spaces are, where those high-risk areas are indoors, et cetera, and what precautions that can take place.
Thank you. Mr. Premier, can you rule out bringing in tougher restrictions as we move forward? Is this it now?
I can state one thing that I know that every single leader of a country and every single minister of health will state who's had to deal with the matters of the coronavirus pandemic and its complete unpredictability. I will rule out nothing. That is where it is. We take it day by day, week by week, month by month. This pandemic is continuing to change. What I can rule out is a reckless approach to the management of this pandemic. We have continued to be very steadfast in this. We continue to learn the lessons. We continue to upgrade our defenses, and that is what I will rule out. But I'm not going to make any prognostications of what may or may not happen in the future. This is a live issue, and it continues to evolve. And I look forward to the day where we're no longer discuss the coronavirus. But as the Minister of Health has advised, and the Chief Medical Officer has advised the Cabinet, that will not be for a very long time. And that's why it's important that we make the adjustments which are necessary for the country to live with the coronavirus. And that's why I encourage all persons who have not yet been vaccinated to speak to their doctor and to see whether or not getting the protection is best for them.
Okay, thanks. Final question. Reverend Nicholas Tweed has said that the PLP cynically weaponized the airport reorganization when you were in opposition, and your only real complaint was that you hadn't drawn up the deal. How would you respond to that?
My response will be like this. I would say that Reverend Tweed, who is my pastor, preaches social justice from his platform and his pulpit every single week. And it is not unsurprising to me that a week before the Royal Gazette is going to print a massive spread on regards to the 5th year anniversary, December 2nd, that they have finally decided to pay attention to what Reverend Tweed is saying. That is not in any way, shape, or form a coincidence that's lost on me or many other persons in the country. The airport deal is a bad deal. Everyone is entitled to their opinion. I'm not going to comment on persons' opinions, but what I can comment on is the very real live situation. A government chose to divert its energy and efforts to a vanity project at the airport, which was opposed by myself as the Shadow Minister of Finance in opposition, and the current Minister of Transport, who stood in opposition. Our plan at that point in time was to spend the money to renovate the existing building as there were more pressing infrastructure needs in the country, such as investment in education and clearly investment in infrastructure, such as which we're seeing at Tynes Bay. So for me, I'm not going to comment on what people's opinions are. I can speak to the facts. And the facts are that our Treasury is critically challenged due to the decisions that were made by the former government in the pursuit of this deal, which in the minimum revenue guarantee has cost us over $40 million during this pandemic. And in addition to that, the amount of revenue which has been foregone has caused us to spend an additional $13 million in our budget every year without having the benefit of the airport revenue. So that is the opinion of others. I'm going to state the fact that it was not the best decision. And as governments, we have to make sure that we make the correct decisions for the correct priorities. It was the wrong decision that was made at the wrong time, and we are now paying for it not only with our budget, but now in real world impacts.
Thank you, Sean.
My mask. Jasmine Patterson with Bermuda Broadcasting. Thanks for your comments today, ministers. The first one's for the Premier. Going back to the Marsh Folly waste facility, with increased waste expected over Christmas, what assurances can you make that Marsh Folly is prepared to receive it?
What I've been advised is that this is a very temporary solution. It is not something that is anticipated in any way, shape, or form in the long term. And as I said in my statement, that we will be examining alternatives because the people who live around Marsh Folly do not deserve this in any way, shape, or form. At the base of this, and I'm not entirely certain if the minister covered this, is it's being hit by COVID supply issues. And the baler and that thing is we're literally looking at a single $100 part that we aren't able to procure, that the supplier is unable to procure, and to think that that is something that is that critical, but that's where we find ourselves right now. But it is not anticipated to be long-term at all. It is a short-term item. When the boilers get back up, the solid waste will come from there and will go ahead and to be incinerated in the regular fashion. And I know that the team over there is incredibly dedicated. And what I would do is I would certainly encourage your media organizations to go there to speak to the people, to have a greater understanding of the challenges which they're facing, because it is a very dedicated team of Bermudians who are over there who are doing yeoman service for this country, and I just want to applaud them.
In terms of short term, are we talking 3 to 6 months?
Oh, nowhere near that long. No, the expectation is no more than 2 weeks, if anything. Oh, so when your question came in about the Christmas period, I think it's my view is that we're not anticipating that long. I mean, the short term matters in order to get us to the place where we can continue to get the boilers back up is not expected to be more than 1 or 2 weeks. But the interim items, because I think the minister had stated when he gave a press conference here about 2 weeks ago about the major upgrades of which are going to have to take place to tide us over 3 or 4 years before the complete replacement of the facility, those are expected to commence in March or April of next year. However, the work which they're doing now should prevent any further need to resort to the landfilling before that time. That is the aim. And so it is expected to be incredibly short term. And as I had indicated in my statement, we're looking at alternatives because the people of Marsh Folly don't deserve this.
Okay, thank you. For Minister of Health, it does overlap into education as well, but I wondered if 100% of staff and students are getting tested. Think of that.
Thank you. Thank you for that question. The saliva screening program within our schools is we require the consent of the staff and the parents, and there is none of our schools are at 100%, but I can state that none of them are below 80%. So they're between 80% and about 95%.
Are there any actions being taken to mitigating some of those not being tested or those falling through the cracks?
Well, that was the rationale behind the 80%, and because we wanted a number that said if we reached a certain percentage, will we be able to move forward? So that's why we were able to implement the 80%. We continue to educate and put the word out there and encourage parents to consent. But at this particular time, it is optional, and we're just thankful for those parents who have consented. And there are quite a few of our schools that are in the mid to high 90s, and so we're very happy that we are at that point.
Thank you.
All right.
Finally, for Minister of Health, have you seen the uptake in those receiving booster shots that you anticipated?
I don't have the number in front of me right now. Actually, it was reported, I think, yesterday in the press release, but we are still seeing an increasing amount of persons signing up for the booster now that we've extended it to 18-year-olds, provided that that 6-month period has expired from the last shot. We are anticipating that we'll have far more individuals in that age group also signing up to get the jab. So we are encouraged. We will continue to offer the first and second jabs as well. Vaccinations as well. Our general numbers of 79% for the eligible population is encouraging 70% of the entire population, but we want to continue to ensure persons have the opportunity to avail themselves of the vaccine. The United Kingdom has assured us that they will continue to provide and supply us with the requisite needed vaccines for those persons that wish to take that. And we know from evidence and science that the best measures with respect to minimizing the impact the devastating impact of COVID disease, hospitalization, and death is through vaccination.
Jasmine, just a quick follow-up to what the Minister of Health has said. Certainly on this particular issue, I think it's important to note that I think, Minister, it's accurate to say that the vaccine appointments for every day have been fully booked. So that's just a sign of the take-up, which we've certainly seen, and that is certainly a good sign.
The antigen tests are considered to be far less accurate. What is the rationale behind switching to antigen, and are you confident in it?
The antigen test, you're right, the level of sensibility in some of the antigen testing isn't as accurate as the gold standard for the PCR, which is why upon arrival to Bermuda, persons will be required to have both. They will have to have the PCR test as well as an antigen. And what we're doing is looking at how best we can allow visitors to our island to start the enjoyment of their vacation. The PCR test could take several hours, and that could be the difference between having a cocktail at the beach and sitting in your hotel room waiting for the test. So we'll be doing both of them simultaneously, and the antigen test is a quicker test, and assuming that the antigen test result is negative, then those individuals will be allowed to go ahead and start their Bermuda holiday.
No problem. Thank you very much, members of the media, for your question. Thank you, Minister of Health and Minister of Education. I would ask all persons to continue to make sure that they stay updated by looking at gov.bm/coronavirus or coronavirus.gov.bm to have all the latest information. And I would ask all persons to continue to observe public health protocols and continue to do their part to make sure that Bermuda can continue to move beyond the pandemic. Thank you.